Hello, everyone. My name is Olivia, and I will be welcoming you to the event with our land acknowledgement. So, Ani, Olivia Indigenous Cause, Toronto and Dunjba. My name is Olivia, and I come from Toronto. The Arts and Science Undergraduate Society is situated on the stolen lands of the Anishinaabe and Haudenosaunee peoples. To acknowledge this land is governed by the 1783 Crawford Purchase is to acknowledge the colonial construct of land ownership and the violent theft of land from its original caretakers. We must acknowledge that many of the initial land treaties were based on exploitative intimidation tactics and were made under the premise that the colonizing government would care for the lands that they were forcibly acquiring. Unfortunately, these promises have not been upheld. As a person who is both Indigenous and a settler, I have an incredible amount of responsibility to use my privilege to protect and uplift the voices of those who have been silenced for centuries. These peoples existed on this land long before me and acted as caretakers, caregivers, and appreciators of the land, water, and sky. Inhabiting this land to me comes with lots of responsibility that I am actively relearning. Land is not simply the place where we are situated, but it constitutes the resources, both physical and spiritual, that allow humans to exist. This acknowledgement acts as a miigwech, a thank you, to those who came before me, those who surround me, and those who will come after me. In certain Indigenous worldviews, it is understood that our actions will impact the next 7 generations to come. As we continue to exist on these lands, let us acknowledge the enduring impact our policies, language, and actions have on our descendants. Thank you very much. Good morning, everyone, and welcome to our COVID-19 Q&A session with Dr. Budemer, hosted by Asus with the collaboration of the Faculty of Arts and Science. Please note that our session this morning will be recorded, so we are able to provide the information to those who are unable to attend at this time. In the instance that you require transcription, you are able to activate subtitles on the menu bar at the bottom of your screen. We will begin the session with an introduction of the panelists, followed by a moderated question and answer period, and close with some information on resources. If you have questions throughout the session, please send them directly to Asus Administrator, and we will add them to the queue. We hope to be able to answer all of your questions. Sorry, Brandon's having some technical issues, so I will go ahead and introduce the panel. My apologies. We will begin with an introduction of our panelists for today's session. We thank them all for their time and willingness to participate in answering students' questions. Dr. Samantha Budemer is a public health medical doctor and family physician. She holds an MD from Queen's University, an MSc in public health from the London School of Hygiene and Tropical Medicine, and a BHSC from McMaster University. She completed her residency training in both family medicine at Queen's in 2017 and public health and preventative medicine at Queen's in 2021. She is currently acting as public health advisor to Queen's University, associate program director for the PHPM residency program, and teaches master's courses in health systems, health policy, and management. She also maintains her clinical work through a focused practice in sexual health and immunization at Student Wellness Services and locum family practice at Queen's DFM. She's interested in bridging the gap between primary care and the public health with a focus on equity-deserving populations. Her academic interests center on medical education and health systems. We are also joined by Barbara Crow, the Dean of the Faculty of Arts and Science, Bill Nelson, the Associate Dean of Teaching and Learning of the Faculty of Arts and Science, and Jill Atkinson, the Associate Dean of Academics of the Faculty of Arts and Science. Thank you all for joining us and being in attendance today. We will now move to the moderated section, question and answer portion of the session. At this time, we welcome attendees to send any questions they may have to Asus Administrator, and we will jump right in with some questions for Dr. Budemer. So the first question that has been posed is, as many students are engaging in increasing social interactions, some of which have become unsafe, what assurances do students have that the classroom remains safe?
Sure, absolutely. Thank you so much for the introduction. Hi, everyone. Feel free to call me Sam. Dr. Buttimer sounds very formal, but everyone just calls me Sam. So feel free to call me Sam. So the interesting thing about COVID and environments is that it really has to do with each particular situation is kind of a different risk assessment. And we have a lot of things in place on campus that help us feel confident that campus is a safe space for people, even if we know that there is still some COVID transmission in our community, particularly sometimes in environments that students are engaging in. And I'll just kind of walk through why that is. And just to preface all of that, we have had cases on campus so far. We know this through our work associated with KFL&A Public Health. But as of at least last Friday, and I didn't hear anything different in our morning meeting today, we haven't seen any transmission in classroom settings on campus. So even though we know we've had cases of individuals who were potentially infectious on their time on campus, we have seen zero transmission. And there's a few reasons why that is. We kind of think of it as a layered approach. So the first layer of our protection is through vaccination. On campus, the vast majority of our student and staff and faculty population is double vaccinated against COVID. There is also a portion of people who are partially vaccinated, and those individuals are due to be fully vaccinated by the middle of October, and otherwise they're not going to be allowed on campus anymore. There is a very small population of people who have exemptions, but the true medical exemptions to COVID vaccination are very, very rare. And so we have very, very, very few people who qualify to have an exemption to having vaccination and being allowed to be on campus. So we know that the vast majority of people are therefore fairly well protected against COVID. And that helps us in two ways. One, we know that individuals who have been vaccinated against COVID, if they do develop COVID, if they get an infection, they tend to be less infectious than individuals who have not been vaccinated. So their viral loads tend to kind of sit lower. I don't have the graphs with me. Gerald Evans had some great graphs. And for anyone who wants to kind of hear his presentation on this, he goes really into detail on it for the principal's town hall yesterday. The videos are going to be posted shortly. For anyone who tuned in, there was some technical difficulties, but the videos are going to be posted shortly. So you can kind of get some further detail on this. But basically the gist of it is people who have been vaccinated are infectious for shorter periods of time and have less viral loads. So they tend to be less infectious than their unvaccinated counterparts. They're also significantly less likely to catch COVID in the first place. So we have seen some clusters where they've kind of looked through all, there's an example of some sports teams that had cases. And in those situations, vaccinated individuals who developed COVID, no members of their household who were fully vaccinated also developed COVID. So we know that if you kind of have this double vaccinated group, so the individual who has COVID and then the people that they're around, if they're all vaccinated, the transmission is just a lot lower because the individual has a lower viral load. And then also from the side of the individual who is potentially being exposed, they're less likely to catch it. It seems to be about 9 times less likely to catch it than individuals who are not vaccinated. But all of this data is still coming through, so we don't necessarily have fixed numbers. That said, in the context of Delta, it seems about you're 9 times less likely to catch COVID. So we have this layer of protection of both the individuals being kind of with COVID being vaccinated and the individuals who are potentially at risk of getting COVID being vaccinated. And that really helps keep our campus safe. But we also have other measures in place that are quite effective. In the past, distancing was a big part of us keeping safe from COVID. And that's when nobody was vaccinated. And very few people would have had natural immunity because very few people would have been exposed to COVID in the community. So we have a very vulnerable population and we needed stronger interventions to prevent transmission. We also know masking is quite effective at reducing COVID transmission. We have lots of data to show this at this point, that masking is very effective, particularly when you use non-woven masks, which is what we generally recommend. This is what Public Health Agency of Canada recommends as well. If you are going to wear a cloth mask, ensure that one of the layers on the inside is non-woven, in order to basically it prevents more droplets from getting through. It's more effective. And so you can buy those boxes at the pharmacy, or I know Costco sells them. They're called non-medical masks. They're those disposable kind of blue or white masks, and they're not woven. And that's the key. So we have mask mandates still on place in campus to ensure that people are protected. And so we used to need masks plus distancing, but now that we have vaccination, masking is proving effective on its own at reducing transmission, as long as the people in that room are very low risk, right? So as long as the people in that room are vaccinated themselves, which the vast majority are, and as long as the people in those rooms are not symptomatic. So that brings in our third layer of protection that's so key here, and that's our screening, our daily screening that we're all required to do to come on campus. We know that the data that has come, so the province, whenever you go get a COVID swab, I don't know if you've been to get a COVID swab. I've been to get a COVID swab. I have a toddler. She brings viruses home. We've definitely gotten sore throats and runny noses at my house. And so I've had a COVID swab done, and I've brought my daughter to get COVID swabs done. And when you go, they ask you questions. So they don't just swab you. They ask you, have you had a fever? Have you had a runny nose? Have you had a sore throat? They ask you a bunch of questions, and this is important. This is data that the province then collects, so we can know, of all the people who got COVID tested, which symptoms are most strongly associated with a positive test. And so this is how the province actually cut runny noses, to my pleasure, because I have a daughter whose nose is constantly dripping, cut runny noses from the screening tool. It's because runny noses on their own with no other symptoms were not particularly sensitive at picking up COVID cases. People who present with just a runny nose really didn't have COVID the vast majority of the time. So they cut that question from the screening tool. Same with sore throats. If you have a sore throat and no other symptoms, or a sore throat and a runny nose, the chances of you having COVID were very, very, very low. And because of that, they cut those questions from the screening tool. So the screening tool includes symptoms that are highly associated with positive COVID tests. Meaning if you have a fever, your chances of COVID are not zero. They're decent, they're substantial. They're not necessarily particularly high in our community, because our COVID rates are generally very low in our community, but they're high enough that we want to get those people swabbed. So symptoms like muscle aches all over your body, fevers, a new cough, those are associated with COVID infection. And therefore, those are the reasons we get swabbed. And those are the questions on our screening tool at Queen's. So if you have any of the questions on that screening tool that come back positive, you are not supposed to come to campus. We know that some people don't always follow those kind of rules. We encourage everyone to follow them, and that's why we've ensured that there's academic supports in place for people if they miss class this year. But the vast majority of people do listen. And so we know that that's another way to get symptomatic people off campus. I must say, I teach some master's courses. I teach a course for the MPH students right now. And I've done my classes for 3 hours Thursday afternoons. And in those classes, I don't hear coughs. It's weird, because usually when you're on campus, most years, you hear a constant chorus of because everyone comes to school sick. But this year, it's different. There's still a bit, right? You know, once in a while, my gosh, my throat gets caught sometimes I cough, but it's just a lot quieter, which is a nice change, because people are staying home when they're unwell. And so when we know that we know symptomatic people tend to transmit COVID more readily. So if we get rid of symptomatic people on campus, if we put them in masks and we have them vaccinated so that their viral loads are lower and they have more personal protection against infection, we prevent campus transmission. Public health is not about zero risk. We balance risks, right? There's risk in our everyday life. I step out the door, a car could run into my driveway and knock me over. It's a very low chance, but it's not zero. Every time I leave my house, I'm at risk of something bad happening to me. What we do in public health is we try to make sure that the risk is mitigated as much as possible, and that we're doing things that have clear benefit. This is why we've opened up classrooms, because it's important for students to be on campus learning with each other in person. It's a superior environment for most people. Online learning has its place, don't get me wrong, and there's definitely people who succeed in that environment, but we know some elements of teaching need to be in person. And we needed to prioritize that this year. But you'll notice that on campus, not everything's exactly the same. We don't have widespread mask removal for eating in widespread environments, right? People are generally masking at all times. We don't have the same elements, all of the same elements of social gatherings that we used to on campus. That's going to slowly ramp up over the year as our population vaccination rates go up and the government can cut more and more restrictions. But we were given permission to open up classrooms because we knew that we could control the environment and keep the risk low, and there's substantial benefit. So there was therefore a risk of harm to keeping them closed. That's kind of where the decision-making came from. And that's why classrooms in particular were prioritized. It's not, no rules, everything's open, right? It's clearly this specific environment, and it's this specific environment so that we can ensure that our students are learning the way they need to be learning. I hope all of that is reassuring to kind of give you an idea that campus, as it's set up right now, is quite a safe space. And hopefully reinforce this idea that if you're not feeling well, please stay home. 100% please stay home. There will be accommodations in place for you. And the most important thing is that we kind of all follow these processes. Same with, wear your mask when you're on campus. If you need a drink of water in the middle of class, go out to the hallway, make sure you're distanced from people, because again, as soon as you lose the mask, you need the distance to stay safe, right? And so make sure you're following all the rules, and that's the best way we're going to be able to keep campus safe. If we start seeing transmission in classrooms, which public health is watching for, we're going to have to change how classrooms work. So we need everyone to be following these rules so that we can keep our classrooms open and keep our students on campus the way we want everyone to be learning this semester. Okay. That was amazing. But hopefully that was helpful.
No, that was great. Thank you for those insights, Sam. Our next question is, what will the protocol and impacts be of the large amount of student travel at reading break and the winter holidays?
Yeah, so we do expect that depending on where people travel to and what our provincial epidemiology looks like, we do expect to see more cases. We know that when people have different contacts, that increases the risk of transmission, right? But again, as long as those things are in place like we had before, we don't expect that to change classroom safety. If you travel for Thanksgiving, I plan to go back to Ottawa to visit my family. We're going to have dinner in person, right? And if I come back and I have a new cough, I'm not doing my lecture that week. I'm not going to go on campus, right? Because that's the safe thing to do. So that's what we really need the messaging to be, is that if you're leaving town for whatever reason, if you have new contacts, really play it extra safe and be extra careful when it comes to getting screening done. The other thing is, when you're home for Thanksgiving, and maybe you're going to meet up with some of your friends on fall break, ask them, you don't have any symptoms, right? You're vaccinated, right? You can do those things in your social contacts in order to help keep your risk lower too. And we highly encourage that, right? Because you don't want to get COVID. None of us want to get COVID, right? So do what you can to try to keep your risk low associated with travel. But at this point, our provincial prevalence is low enough that it's allowed to travel. And so we have to take that honestly. If we're being given kind of the go ahead, then that must mean that the risk is low enough, particularly for our student population that is, again, majority vaccinated, then we can keep it safe. But we do expect to see probably a bit of a bump in cases after that week, just because people will be going to higher prevalence areas. And that's okay, because the risk to you, not that we want you to get COVID, but if you do get COVID and you're fully vaccinated, the chances of anything bad happening are very, very small. What I would say is, you probably, when you do return from travel, don't go and see vulnerable people. Don't Don't decide to go visit your 95-year-old grandparent with an autoimmune condition without masks on, right? Like, you know, be smart about it. If you keep your contacts to, say, your household for the week in particular after you come back, that will help keep the risk of transmission lower in our community.
Awesome, thank you. The next question is, how will public health measures guide examinations to be run in December?
Right, so it's hard to say with December because we actually expect by December that if you haven't noticed, our Ontario cases have really stagnated, which is a good thing. That means vaccination is working. Our reproductive number of the virus, so the number of people that get infected from any single person that's infective, is sitting around 1. That means our case counts are pretty steady because every one case creates one new case. With time, we expect that to drop because the more our population is protected against the virus, either through exposure naturally, right? Because if you have COVID, you do have some immunity, or through vaccination, which is preferred. It tends to be a better way to protect yourself. So between those two things, we expect our population to become more and more protected as December comes. The other thing is that we're expecting probably in November that we're going to start the rollout for 5 to 11-year-olds. So we're going to have another cohort in our population that will be protected, which brings our population immunity that much higher, which helps, again, reduce transmission substantially. So we're probably going to continue to see kind of rates drop as long as we keep the measures in place that we have currently, and as long as we continue vaccinating. So there's no reason to think that we won't be able to do exams on campus. And again, the same rules are going to apply in examination setups that apply in classrooms. Wear your mask. The nice thing is that exams are actually a little bit distanced because they don't want people looking at each other's exams, right? So there is a little bit of distance at play, and typically these rooms are actually big spaces, which is a good thing, especially when they kind of do the big gym setup. That's actually a great setup. And everyone's still going to have to screen. And if you're unwell and you can't do your exam, there will be accommodations, right? If you're not allowed on campus because you have a new cough, you will not be penalized for missing your exam. There will have to be some way of either making it up or maybe making up your grade through other mechanisms. That will be, to be decided with the professor. But you're not going to fail the class because you missed the exam because you had a cough and you screened out and couldn't come to campus. So please, there's a lot to be stressed over this semester. Please don't let that be something that, you feel stress about, because we're really here to make sure that we're here to make sure that you have a good experience. I can honestly say, having sat at many meetings over the summer around planning for return to campus, the priority has always been the student experience in terms of learning. We want our students to have the best education possible, and we firmly believe that involves being in class with each other. If that involves in-person examinations as well, then we're going to do that with the same rigor that we do classroom setups. Okay. So hopefully that kind of reassures people a little bit. And I know a lot of professors have kind of come up with different ways to run their classes. I don't have an exam in my class this semester. I'm not an exam person that much anyway. Usually I like assignments better, but especially with COVID in the winter term and then this term, for me, pivoting away from exams made sense. But there are still classes where examinations are the best way to show your learning. And so those are still going to run forward the same way that we run classrooms.
Great, thank you. The next question is, what is the basis of restrictions to on-campus extracurricular activities?
Yeah, so this partly has to do with the government free pass sort of that we've been given. So the government has given us an exemption to the stage 3 restrictions, which is how we're allowed to open classrooms. That exemption does not apply to everything on campus. It applies specifically to classrooms, which means we can't just part of the challenge with extracurricular activities is that they're not moderated necessarily by a staff or faculty. Part of the responsibility of faculty is actually to ensure kind of a safe workspace for themselves, and same with staff. And so they're watching to see, you know, is everyone masking, that sort of thing. We don't have any of those checks and balances in the extracurricular setups, which makes it challenging. But that said, I think the province is slowly reopening, right? If you haven't noticed, we're reopening to sporting events and stuff like that. So over the semester, as we're kind of given the go ahead from the province, we can work towards having more in-person extracurriculars as well. I think there's a good chance that just, you know, the winter term will be more normal from that regard than this term has been. But fundamentally, our priority has always been keeping the classrooms open. And because we were confident we weren't going to see in-classroom transmission, but we weren't 100% sure. And so we need the data that we're collecting right now in classrooms to show that they're safe, to be able to then say, okay, we can start doing more and more and more. It's on our radar. It's not like we're, you know, trying to be mean. We recognize extracurriculars have a role in your education and are really important. And so there is, you know, awareness of that. And I expect with time that will return more to normal, but the number one priority has to be classrooms.
Great. The next question is, when should students get tested and what kind of test should they be looking to receive?
Okay, so a lot of people have been asking, you know, okay, there's these rapid tests you can get, there's these PCR tests you can get, what should I do? I've heard of some students saying, oh, my friend had a rapid test and I had a new cough, so I took the rapid test, it was negative, so I thought I was fine. The only acceptable test for ensuring that you do not have COVID from kind of the province's perspective is the PCR test that you go to Beach Grove to get done. Okay, so Beach Grove is that, it's at King and Portsmouth, near this Providence Care Hospital. The bus goes right there. It's not too hard to get to. You could walk if you wanted, if the weather's nice. And you book online to get those tests done. That would be the number one way. So if you develop any symptoms, you know, do not pass go, book your appointment, go get your COVID swab done at Beach Grove. The rapid tests are being used by the province for asymptomatic surveillance of individuals who are not vaccinated. So anyone who's not fully vaccinated on campus needs to be doing those tests. And if that applies to you, you should have gotten some information about it. And if you haven't gotten information about it, let me know and I'll make sure you get the info. But they're just not quite as sensitive, so they don't pick up as many cases in positive individuals, particularly in the case of symptoms. And we want to be very confident that if you have symptoms, you don't have COVID. So that's why we recommend getting that PCR test done. Some people like using the rapid tests to kind of reassure themselves before social contact. And if you have access to them, it's not wrong to do. If that adds an extra layer of reassurance, that's good. But fundamentally, they miss a lot of positive cases, and they're also prone to false positives sometimes. Not as much, but a false positive would be a real hassle, because if you get a positive on a rapid test, again, you're supposed to act as though you have COVID and go get your PCR swab done, and then you're isolating. And so if you're asymptomatic and you do the rapid test and it's positive, it obviously would therefore end up being a bit of a hassle for you, but it might be a true positive, and therefore you caught the case, which is not a bad thing. So rapid tests aren't fully bad. They're just not the standard that's needed to be able to come back to campus if you've got symptoms. So if you have symptoms, PCR test, the nasal swab. If you want to kind of reassure yourself, you can use some of the rapid tests, but I think truly they're not that useful. I think what's more useful is symptom screening and PCR testing.
Great, thanks, Sam. The next question is, what is the expectation of students if those they are living with become symptomatic?
So if you're fully vaccinated and someone in your household develops symptoms, you do not have to self-isolate, but we generally recommend, you know, it's probably a good time to keep your mask on. Don't go out for dinner with friends, that sort of thing. Try to keep your contacts low until they get their test back, if you can. But in general, if you're fully vaccinated, you're not required to self-isolate. And part of the reason you're not required to self-isolate is that we do see some household transmission of COVID between fully vaccinated people, but it's a lot lower than when people aren't vaccinated. And so and also we know that, until you're symptomatic and you're fully vaccinated, the risk of you transmitting COVID to someone else is pretty low. So you don't have to self-isolate if you're fully vaccinated. That's 14 days after your second dose. And public health will kind of instruct you on that. They'll contact any close contacts in that regard. But the big thing is, if your housemate develops symptoms, make sure they get tested, because I think that's actually the bigger problem. Is a lot of people develop a new cough and they just don't want to go through the hassle of getting tested. So if you have a housemate that you've noticed has a new cough or really seems unwell, you can say, hey, have you gone to get your COVID swab done? Like, it's a good idea to get your COVID swab done. And it's not a bad idea either to kind of distance yourself from that unwell person. I mean, that applies outside of COVID. If somebody has the flu, you probably don't want to sit next to them on the couch, right? Like, you don't want the flu. So, regardless of what they have, whether it's COVID or something else, like, it's probably a good idea to do a bit more hand washing. You could wear a mask around them if you wanted. That's not particularly harmful, but really just like try not to spend too much time in the same room to protect yourself. Societally, for a long time, we've been comfortable being around people that have communicable respiratory diseases, right? Like, it wasn't uncommon to show up at work with like a runny nose and sneezing everywhere. But we kind of want to change the norm on that, like, being sick sucks. Like, it really sucks to get a cold. And so if you can help reduce your risk just by being aware of it and doing a few interventions to try to distance yourself a bit, it's not a bad thing. For people like me with a toddler, it's pretty hard to distance myself from the toddler sneezing in my face. But my husband's been sick, a few times as well when I haven't been. And we just, he sleeps in the other bedroom. And like, we do a few things to try to keep ourselves not quite so close. We're, just to reduce transmission, because I don't want to get sick.
Great, those are great insights. Thank you. The next question is, what approach will the university take for handling outbreaks in classroom or on campus should those occur?
Yeah, so, well, technically, we already have a process in place, and KFL&A Public Health really helps us with this. Anytime there's a case identified of an individual who's been on campus, Dan Langham is notified and works with that faculty to determine what classes that individual was in during the period of communicability, so when they had potentially infectious COVID, and helps get the email addresses to public health, so public health can email that class to let them know about the risk. Public health does an assessment based on where people are sitting in the room and what the room is like in terms of determining risk. So deciding, is this high risk versus low risk exposure? If it's high risk exposure and the person's fully vaccinated, they're still allowed on campus, but they're required to get a few PCR swabs done. Whereas if they're low risk, they're not required to get surveillance swabs done. However, if they develop symptoms, of course, they should get tested, right? At this time, we haven't seen transmission in the classroom setting. So because public health gets the names of all the people in the classroom, they know then if they get another positive that comes in, they see who, they cross-reference. Is this a contact we know about? Every contact is put into this contact management system. And basically, as soon as a positive test comes in, the name gets typed in to see, do they have contacts that we know about in the period of communicability? So all of that data is collected, and at this point, we're not seeing transmission, so there's no further action that needs to be taken. That said, if we see, oh, this person and this person were in the same class, they have zero contact otherwise, this person had like no social contacts with positive cases, like there's no other place they could have caught COVID except for the classroom, then we're going to change what we do in classrooms. We probably won't change what we do in classrooms across entirety of campus unless we see a lot of on-campus spread, but we would probably at least change what we do for that cohort of students, right? So if there's any other high-risk cohort individuals in that classroom, they might be instructed to not come to campus for 10 days, or the class itself might be moved online just so those people are not in a space together. We don't have a specific plan in place because it's all about individual risk assessment. And so really we need to just decide what to do situationally for when the context happens. It's bigger risk if those, if the students are faculty of health sciences students and they're going into the hospital, that's a bigger risk from a public perspective than if they're students in another faculty who don't have contact with high risk vulnerable people, right? So it's all a risk assessment, which means we don't have a specific plan in place, but we have a lot of different actions we can take if we need to. That said, at this point, we really just watch all the contacts, and we haven't seen transmission, so we haven't had to do any of these things. Public health works with us hand in hand on these sorts of things, because fundamentally they're the ones who have the ability to tell us, no, this is a risky environment, you're shutting that class down. But at this point, we haven't seen transmission, so there's been no need.
Awesome. The next question is, what should students do if they are hesitant or worried about getting a COVID-19 vaccination?
Absolutely. So if you're a student, you can come see me. I have a clinic at Student Wellness Services. I would love to see you, and feel free to call them to book an appointment. My clinics are Tuesday afternoons. I have a clinic that's starting at noon, so it's all virtual, so I do it all by phone, and I would be very happy to talk to you more about the vaccine. Hesitance is normal, which I know sounds weird to hear coming from a public health doctor, but actually, we know that there are people that just in general, for a variety of reasons, have hesitance about vaccination. That does not make you a bad person. That doesn't mean that you're antisocial and you're an anti-vaxxer. It just means that you have concerns that might be different than a lot of other people in the population. And I'm the person that can talk you through it and talk to you about kind of vaccination. If you're thinking more about someone in your life who has not been vaccinated, because I know the vast majority of people listening to this will have already been vaccinated because it's a requirement to be on campus. But if you have someone important to you in your life who's not been vaccinated because of hesitancy, I think 19 to 0 has some good content on their website on how to talk to people about it. And let me put the link in the chat, actually. I'm just going to pull that up right now, because you actually need to try to stay open-minded and responsive and empathetic. So if somebody comes to you and says, I'm scared of COVID vaccines, don't say, you shouldn't be scared. You should just get it done. It's the right thing to do. That really minimizes their feelings and anxieties. And so it's more important to actually take a step back and say, oh, like what makes you so concerned? Tell me more. Definitely new things can be scary. Like I get that. What's going on? What makes you so worried, right? Because then you can start addressing their specific concerns and connecting them with resources, people like myself or their family doctor who can help answer those specific concerns. I've spoken with a lot of hesitant people, and in taking that approach, sometimes it takes more than one conversation. I've spent, more than an hour talking with people, but I have a lot of people that I've spoken with and taken that approach with that have then gone to be vaccinated despite their hesitancy at the beginning. So it can be really effective if you just spend the time and stay empathetic. It's hard. It's hard, but it's worth doing. So, you might feel frustrated because you're like, we just need to get out of this. Please just do the right thing. But really, truly keeping that open-minded, empathetic approach is the way to help get people on board.
Great. A bit of a follow-up to that question. How effective are vaccines against new variants of concern?
So, thankfully, very. If we had still only had wild type COVID, we would be not seeing any cases right now. Our vaccines would be, our herd immunity would be high enough that our reproductive number would be in the pit. Like we wouldn't be seeing cases. In Ontario right now, 99.5% or more cases are Delta, which means that at our current levels of vaccination, we totally have herd immunity against Alpha and other wild type COVID. We see sporadic cases that come up generally through importation, through like people traveling and stuff like that. But the in Ontario transmission of COVID is predominantly Delta. And that reflects the fact that Delta is just that much more transmissible than other types of COVID and has kind of outcompeted the other types of COVID to be the dominant COVID in Ontario. But thankfully, vaccines are still effective. They're not 100% effective at preventing infection, right? Like I said, you're about 9 times less likely to get Delta from someone if you've been vaccinated, but it's a lot better than zero. But really where the vaccines shine is that reduction in hospitalization and death. The vast majority of people do not develop serious illness once they've been vaccinated against COVID. And that holds true with Delta, which is very, very, very reassuring. And a big part of why we can reopen our province and why our ICU rates aren't skyrocketing despite the fact that we're seeing 600 cases a day. It's because the vaccinated population and the people that are vaccinated that are developing COVID are not going on to develop subsequent problems that put them in hospital. So we require a higher rate of vaccination in our population to squash Delta, but we are getting there. In talking with Dr. Evans yesterday, he's the infectious diseases doc at Queen's, who is in the principal's town hall. Feel free again to look for that video when it comes out. He and I were talking about it, and he said that for a variety of reasons that he would understand better than I would, and that virologists understand better than I do, it's very unlikely that we're going to see a variant become more efficient at transmission than Delta has, just because any mutations that go any further would likely impede its ability to infect cells. That's as far as I can explain it. But it sounds like there's a general thought that we've kind of reached peak COVID a little bit. Is that guaranteed? No. And that's why we're doing surveillance. That's why we check every single positive COVID case in this province to see what strain it is, to see if it's a new variant. So far, we're not seeing any new variants emerge. If we do, we will cross that bridge when we get there. And cross your fingers, hope not.
Great. Do you have any insights on booster shots and how they may impact university-aged adults?
So I think it's pretty unlikely, I think it's pretty unlikely that the general young adult will need a booster shot anytime soon. We see really good responses in young people to the vaccine in general. And often with many vaccines, younger people actually require fewer in order to build a strong vaccine response. The other thing is young adults are not really at risk of complications. Once you've been fully vaccinated, the chances of anything bad happening to you from COVID are like non-existent. So that kind of makes it less necessary to get a booster shot, because again, you don't want to get sick, but if you get COVID and you get better really quickly, it's not the end of the world, right? It's kind of like any other illness we've already been exposed to. What we're worried about is people having to be hospitalized or dying from this. And so that's why the boosters have been oriented towards people who have autoimmune conditions. So some individuals who are students might qualify for a third dose based on that because they're on medications or have conditions that reduce their ability to kind of fight off a virus, and older adults, because they tend not to have as robust of immune responses to vaccines to begin with. They might need a little bit of an extra dose to really get their immune system going. Healthcare providers, because we don't want them giving COVID to people who are at risk of COVID, might be getting a booster sooner, just more, not so much for because we're worried about them having complications of COVID, but really to help make sure that they're not transmitting COVID to others. So that might come up soon. Otherwise, I don't think we're just not seeing that much vaccine escape to warrant the entire population needing a booster now. And that's consistent, with what the CDC has put out. They're not recommending boosters to everyone. They're recommending boosters to specific populations. And we'll see Canadian data kind of come out and give us guidance on that in the months to come. If you're told to get a booster, get the booster. Follow the directions, right? Again, there's a lot of smart people who spend a lot of time thinking about kind of the reasons for any of these things. So as a healthcare provider, if they tell me, hey, you see vulnerable people, you should make sure that you get that booster, I'll do it, right? But otherwise, if I'm not stressing about not having a booster yet, if that helps make you feel better.
Thank you. This is the final question of our moderated Q&A section. So what were the central reasonings and processes behind establishing the COVID-19 guidelines that we currently see on campus, and what stakeholders were involved in these decisions?
Okay, so the COVID guidelines were created kind of in partnership. I did a lot of the advising on this along with David Walker, and we got input from other physicians who are associated with Queen's on kind of what the guidance should be. But all of this is constrained by whatever the province told us to do, which again, there's lots of really smart people working for the Chief Medical Officer of Health's office. Kieran was my program director while I was training in public health. I know him very well. I'm very confident in him leading that office and his abilities. So we're kind of constrained by the province's guidance, and then we developed our own internal guidance to kind of get us that extra mile. But it's all kind of in the context of what the province has told us to do. So it's in partnership with some public health professionals like myself that Queen's has hired to work on this. And then also, working with the deans. I see Barbara in meetings all the time, and other people from the Central University office, coming together to come up with what makes the most sense from an infection prevention perspective, and also from a kind of a student wellness perspective and an educational perspective. The local public health unit does not have jurisdiction over these things. The health unit has the ability to put orders in place for specific risk contexts. So for instance, they can close a restaurant, but it's very difficult. Not necessarily impossible, but kind of the way the legislation is written, they can't really come in and say, Queen's, you have to run your university this way. The province can, and the province has, but local public health doesn't do quite so much of that. So they're really involved in terms of helping us with the case management and contact management. So when we developed our case and contact management protocols for on campus, that was done in partnership with KFLNA Public Health. We came up with our documents, we shared it with their case management team. They kind of told us if there were any tweaks we needed to make, and then we went from there. So hopefully that kind of gives you an idea of where the partnerships lie. But in terms of kind of our return to campus with masking, vaccination, screening, no distancing in classrooms, that was kind of a communal decision with input from people like myself.
Amazing. So that concludes our Q&A session. We would like to thank everyone for their attendance and engagement today. We'd also like to thank Dr. Samantha Buttimer for her time and care in responding to questions from students. If you have any questions that remain unanswered or would like to learn more about how the Faculty of Arts and Science is ensuring safety in the classroom, please do not hesitate to reach out to us directly at president@asus.queensu.ca. In addition to resources available on our website, we will be posting a recording of this video on our social media pages, so please stay tuned for this. Again, thank you all for attending this morning, and we hope that you have a wonderful day. Bye, everyone.